Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Ballins.
Hi there, Dr. Darrow.
How did you know I'm living it up?
You're always living it up.
I try to. I like to have a good time.
This is a good thing.
How about you? What are you doing?
I'm great. I'm just enjoying life. I mean, I'm just here to have a good time and support you. This is like the best.
You're the sweetest.
Why, thank you. So,
how many years together on this
we
show?
started in October of 2009.
Oh, my God. You were only like 3 years old.
Well, 3.5.
Well, let's get right into it today. We're going to talk about how to heal your musculoskeletal pain without surgery. That's the keynote. How do we say it, Nita? Take the surgery out of
pain.
I always preface the show, I love surgeons, and I was on my way to being one until I had a terrible shoulder surgery. The results were awful. And, diddling. And it turned me the other way to do it naturally, which is using regenerative medicine. In the old days, it used to be called prolotherapy. Prolotherapy meaning to proliferate new tissue, to regrow the tissue instead of cut the body open and take tissue out. It doesn't work on everything, but when you choose the patient properly, like anything in medicine, we get amazing, amazing results. Nita, you're one that healed up, remember your neck?
Yes.
Well, how long ago was that? That's a good 15, 20 years ago, right?
Yes, twice, because I healed the first time in a week, and then 4 years later I worked out with my trainer and injured the same area, and then you shot me up and I healed again in a week.
You raised yourself from the from the bottom to the top. How many times did it take with prolotherapy, which is just injection with sugar water?
Well,
do you remember?
Yes, I do remember, because the first time you said you'll come in once a week for 4 weeks for a shot. And I said, why don't you give me all 4 shots today? And you did. And it was great. I was better in a week.
Well, that's amazing. That was back in the old prolotherapy days. Today what we do is called PRP, platelet-rich plasma, and that can be mixed with stem cells for a real bonus type of a treatment. I've used it all over my body. You know, I self-inject when I injure myself, and because I'm a sports addict, I'm repetitive. There's a high probability when I get into doing something like hitting one golf shot for 4 hours straight till I get it down. I usually end up getting a repetitive stress injury or a tendonitis. I've had rotator cuff tears, labral tears. I've had meniscal tears in my knees. What else? Neck pain, back pain, which is what we call Nita's favorite word, an enthesopathy.
Yes, I can even spell it.
Oh, come on.
ENTHESOPATHY.
You're amazing. You're
See what I've learned all these years?
Yeah. I'm going to give out the phone number, Nita, if you don't mind.
Do it.
And with the phone number giving out, I'm going to give you, if you call in today, we've got a lot of time left to get callers, a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it's a $25 book. We'll even pay for postage. So to get to me right now, live and local, 866-870-5752. I'm going to repeat it, so go run and get your pen and pencil. The phone number to talk to me, and if you want to talk to Nita, 866-870-5752. And if there's things we don't cover on the show, you can always reach me at my office. And the fastest way to get there is just the phone number. I'll give it out. It's real easy to remember. It's 800-300 9300, 800-300, 9300. And for those of you that just want to see what's going on, you can go to the website. There's a lot of videos of me doing the procedures. And the website, if you want to write that down, is www.lastemcells.com. www.lastemcells.com. There's endless articles and studies on PRP and stem cells, and it'll teach you how to avoid orthopedic surgery. Now, there's cases when orthopedic surgery is mandatory. You break a bone, and it's compound fracture, it's sticking out of the skin. You better get that operated on right away. But most orthopedic surgeries that I see coming in the office that have failed should never have been done. And I haven't mentioned this for a while on the show, but there is a diagnosis called failed back syndrome, failed shoulder surgery, failed hip surgery, failed knee surgery. And these are diagnoses, and insurance companies don't create diagnoses very easily. It's got to be a lot of times that this happens before they actually codify it. So what I'm trying to get to is these failed surgeries are happening every single day. And I know a lot of you out there have had a surgery that failed. I know a lot of you out there have had surgeries that have done well. The question is, do you need to take the risk of an invasive surgery to get better? My answer is no. I had the failed surgery on my shoulder, my right shoulder, and it blew up like a balloon full of fluid, and had a miserable time for about 4 years. And then I finally discovered regenerative medicine, injected my own shoulder in the evening. And the great fun story for those of you that haven't heard it is I got home, my wife was watching TV. I had a syringe in my hand full of the old prolotherapy stuff. Got into bed, injected my shoulder with her yelling at me with what we call expletives. And
she deleted those, huh?
Yeah. And I woke up the next morning completely pain-free after 4 years post-surgical pain. So it's worked on me in many, many areas. I've done both my knees, both my shoulders, both my elbows, my right wrist. I've had my buddies do my neck and back, and I'm doing pretty darn good. I haven't had to inject myself for a while. I'm thinking back. I don't really remember exactly when the last time was. But my knee was injured from sprinting up my mountain where I live with my husky dogs, Bella and Dakota. I love you guys. And I overuse the body. You know, a lot of us athletes do that. And then we pay the price. So I injected my knees, got a lot better. And then very strange thing happened. I injected my knee with hyaluronic acid, which is a lubricant. And it blew up, my left leg blew up like a balloon. My thigh got very thick. My knee was very painful. I was on crutches for a while. It took about 5 months to heal. I did several stem cell injections. First, I aspirated out the hyaluronic acid. I put it in under ultrasound guidance. It went into the exact spot in the joint capsule. But I probably had an allergy to it. And I don't give those to people. I never did, and I certainly will never do it again. And I use myself as an example. I'm a guinea pig, and that's one thing I'm never going to give to anybody. So if you want to get a hold of me, the number right now to talk to me live is 866-870-5752, 866-870-5752. I'd love to hear your questions on musculoskeletal pain, orthopedic issues, and if I can't answer them, maybe Nita can. What do you think, Nita?
That would be a long shot.
Well, you've been on this show for how many years now?
Since October of 2009.
Yeah, I think you know a lot by now.
I know a lot, but, you know, I'm not qualified to talk about much of anything because I'm not a medical doctor.
You're qualified, well, you're a doctor of psychology.
But I can say my experience.
That's right. So, Nita, I have a question for you.
I'll bet.
Why was the snowman looking through a bag of carrots?
Well, first of all, it's pretty funny. I was just thinking of carrots.
I'm psychic, Nita. I don't know if I ever told you that.
Because I was going to ask you, what does one carrot say to the other? That's what I was going to ask you.
Yeah, but I beat you to the punch.
That's you certainly
Why
did.
was the snowman looking through a bag of carrots? He was picking his nose.
Oh, my God. My joke's better. What does one carrot say to the other?
Tell me, Nita. I'm not even going to go for it.
Okay. Carrots don't talk.
That is not funny.
I liked it a lot. I read it the other day.
But it's not. No one can answer it. All right, I got one more for you.
Okay.
While we're racking up callers.
Okay.
Give me a call to save Nita.
Yeah, really. Give Nita a call to save Nita.
866-870-5752. If you do call in, I'm going to send you a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm looking at it right now. It's got, 250 pages or something like that, with about 256 studies on how regenerative medicine works and how surgery is something really of the past for orthopedics when it comes to things like rotator cuff tears, meniscal tears in the knees, joint replacements, all of that. I'm not saying they're not going to be done forever. There are surgeons that are going to keep doing them. But if they read their own literature, they wouldn't be doing them. Unless it's something that really needs to be done, some kind of an emergency. But then there's always the question of what is an emergency?
There you go.
Yeah, what is it? So, Nita, what do you call a belt made out of watches?
A watch belt.
Close. A waste of time.
Oh, that's a good one. That's a really good one.
Do you like it? Okay, it's so good I'm going to give you one more great one because I'm beside a doctor. I'm also a lawyer, so you'll love this.
Okay.
What did the lawyer wear to court? You can do it.
White jacket.
A lawsuit.
Oh, that's a good one, too.
Isn't that cute?
That's cute. Yeah, those are good. Those are good.
Well, I'm going to go to a question if you don't mind, Nita.
Okay, yeah, we have some calls coming in, but when they come in, I'll just breathe.
You're so fun. You start chomping at the bit. I always know when there's a caller because
I'm so excited when people call.
You start breathing hard.
Well, because people really need this information.
They do. Suzette, give us a name here. We got. Oh, there we go. Almost.
Almost. Well, you could do a really quick question.
Okay, but then then you'll tell me to stop because the caller's name pops up.
Yes, I will.
All right, so we're going to do a question here. This one says, told I need a hip replacement by Dr. I'm not going to say the name, at Cedars. I'm 60 and always very active, even taking professional jazz dance lessons up to a year ago. Never had an injury until last year with a groin pull. We have to be very careful because groin pulls do not equal hip replacements. They're in the same neighborhood, but a groin pull is just the adductor muscle. Now, when a doctor sees arthritis in a hip joint and they don't even touch the body to find out where the pain is coming from, they're doing a great disservice. If you've got a groin pull, we can fix that using platelets or stem cells. That's easy. I do those all the time. However, many people get a hip replacement when it's only a groin pull. Why? Because they have some arthritis. And that's what this guy says. X-rays and MRIs show osteoarthritis in right hip. Not in pain, but not really able to work out. Not mentally ready for a total hip replacement. Well, my God, why would someone get a hip replacement and why would a doctor tell them to do it when there's no dire straits here? I get this all the time. The hip area is very complex. So a lot of people come in, they tell me the same story, and they say, I've got to get a hip replacement, and I move the hip around, and they're fine. You can have arthritis and not have any pain, but we're going to Geronimo. You've got a left leg issue. Geronimo, Dr. Marc Darrow, what's going on with
on with your...
Oh, yeah. But you can scream at me if you like.
Okay. My left leg, last night, I could not even move my leg.
Okay.
And I had a right hip replacement before, so I just had to tell you that.
Okay.
But last night, I couldn't hardly walk, and I came up to the kitchen and got me an Aleve.
Okay.
And went back to bed, and that kind of helped a little bit. But anyway, this is what happens to me. I play a lot of tennis 4 times a week,
Okay.
and which I really like. But after I play, it seems like the problem keeps coming up. Then I start limping.
Okay.
And I went to see a doctor at Beach City's Orthopedic in sports, and they took X-rays. He moved my leg one way or the other, and everything. He said your hip is okay.
Good.
So
Good.
I was listening to your radio. You said something about a growing pull. I don't know what I have, to tell the truth.
Can you give us some idea where that pain is that you have after you play tennis?
Boy, it's hard to pinpoint it, to tell you the truth. And
Is it near your hip? Is it near your knee? Is it near your foot?
it's near my hip.
Okay.
But it's not bone to bone or nothing. Otherwise I won't be able to walk. But even when I walk far, I could start okay, and then when I start walking far, then I start limping, and then it starts hurting.
Is it on the outside of your leg, or is it on the outside of your leg, or closer into the inner side near the groin?
I think it's I think it's closer to the inside.
Okay. Well, you might have a groin pull. Yeah.
You said that a while ago on the radio.
Yeah. And if it is, I don't do things based on MRIs or X-rays or CT scans. That's not how I diagnose. I diagnose by getting a good history from you and then touching the body and moving it around. Okay? So
shall we make an appointment?
Yeah, the number to the office right now, there's people there, 800-300-9300. I'll repeat it for you to write it down. It's 800-300-9300. And if the phones are busy at the office, you can just leave your phone number. We'll call you right back. But yeah, I've got to touch the area.
Or something like that, right?
We're across the freeway from UCLA on Wilshire Boulevard.
Oh, that's close to me. Yes.
Yeah. Well, why don't you hobble on over and I'll take a look. Go play tennis and go limp on over. It literally takes me about 1 minute to diagnose most musculoskeletal injuries without images. Images are really what I call a red herring. They show you something, but it's not necessarily where the pain is coming from. It's not the pain generator. And there's way too many people that get operated on because of an image. And that's not a good way to practice medicine as far as I'm concerned. I get way too many people that come in with a failed surgery, meaning they get a surgery that come out worse. And then I go, did the surgeon ever touch you and examine you? They go, no, they put an image on the light box and they showed me what was wrong. And they told me I need surgery. That's not practicing good medicine. Because the image may have a problem, but that doesn't mean your body has the problem. And you mentioned something else. You said your hip is not bone to bone, but I have a lot of people that come in who are, quote, bone on bone, but that's not their problem because they're not really bone on bone. I move them around, everything's fine, and they go, but the doctor showed me an X-ray and it looked like it was bone on bone. Doesn't mean a thing. Don't get lost in the X-ray or the MRI or the CT scan. Make sure, all you listeners, that you have the doctor touch your body and find out where the pain is being generated from. Because there are way too many surgeries that are done that should never have been done, and I had one in my shoulder, so I know what it's like. It's before I knew about platelets and stem cells and prolotherapy. It's when I was a young guy in medical school, and I didn't know anything. I just trusted my boss. We were doing orthopedic surgeries together, and I thought it was the greatest thing next to sliced bread. I loved doing the surgeries, and then I found out that a lot of people were getting worse after the surgery. And I pushed my boss to do the surgery on my right shoulder, and it came out bad. And that's when I started looking for an alternative, which I've been doing for over 25 years. And I've done mega thousands of patients with great results. If someone doesn't get better from what I do, it's usually their fault, not from the procedure's fault. And when I say that, what I mean to say is they continue too much activity and they don't give it a chance to heal, or they're taking anti-inflammatory medicine which blocks the healing, something like ibuprofen, or they're not getting injected, like go to a different doctor who doesn't use an ultrasound, or they just haven't had enough treatment. It's not a magical cure. This is something that you've got to do until it works. And patients don't like that. In America, everybody wants everything done yesterday. And this can work like that. It's worked on me overnight for some areas. And some areas I've had to do several injections on myself to get better.
Now I have a question.
Sure.
Do you take, you take insurances or not, or is that straight pay, or how does that work?
You know, that's a good question, and because it's varied, you need to call the office to find out. And the number to the office is 800-300-9300. There's certain cases where insurance is going to pay for it, like if you're in an accident maybe, or if you have what's called an MSA, a medical savings account. But generally, medical insurance doesn't pay for regenerative medicine, which is really a crime because it pays for surgeries, which is very expensive. And you'll have to talk to the office on your particular case, though. Okay, Geronimo?
Okay.
You got a great name of a powerful warrior.
Yeah, my dad passed it on, and it's with a J. A lot of people write it with a G, but it's if you want a little history, it became when they raided the Indians raided into Mexico, which was New Mexico then, which it was from Spain or Mexico territory, and it was in a San Jerónimo's Day, which it was a saint that they had in the city. And that's when they were celebrating. That's when he attacked them. And then they didn't know his name. And if you look it up, you'll find his name. But anyway, they said, the guy in San Jerónimo, that's
got it.
When he attacked.
Yeah. That's how I got it.
And so anyway, but over here they put a G on it.
That's all right. Well, that's beautiful. Beautiful story.
That was not his
when
name.
When you come into the office, I want to hear more about it, about your roots. And I love listening to my patients. I really do. All my patients get my cell phone number, and I tell them to call me anytime, day or night, and they get my personal email address also. All right. God bless you, Geronimo.
Thank you, Geronimo.
Wait. He said his wife has something.
Yes.
What's the story with your wife?
She listens to you all the time, and she's
good.
the one that told me, said, "Hey, listen," which I was listening to you on the radio, Dr. Darrow. But I don't know how you pronounce it. I have an accent. I'm from Mexico.
That's fine. I don't care what you call me. Just don't call me late for lunch.
Okay. All right. I will call you, and it'd be nice to see you face to face. And
I think we'll get along real well.
Cure me.
God bless you, man. I think there's good hope for getting you healed up.
God bless you too.
Thank you.
Thank you.
Thank you.
You know what's so funny? I always say God bless you. It's just like a reflex, and I rarely have people say God bless you to me. And so when I do like Geronimo just did, it makes me feel really, really good. I love it.
I love it too. That's great.
So God bless you, Nita.
God bless you too, Dr. Darrow.
Thank you. So may I go to another question or give out the phone number? Let me give out the phone number again. We had some other callers that didn't stay with us. And you guys can call back if you like at 866-870-5752. You can call me right now live. Talk to me and Nita at 866-870-5752. And if you want to just call the office directly, you can call 800-300-9300. If you'd like to see videos of me doing regenerative medicine and healing bodies with stem cells and platelets, go to www.lastemcells.com. We're going to go to a short break. Please call me up and entertain me. I'd love to hear from you.
And Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.